Hello, I'm Dr. Adam Leffler, and I'm glad to be with you here today to talk about the Medicare reimbursable medical supply we know as Medi-Spoon. Now, Medi-Spoon is used to help people that need help with swallowing or taking medication. And it works for youth as well as those that are older. And we're going to explain, first of all, how that process may look in a conditional or traditional nursing facility or skilled nursing facility. First of all, the nurses will have a cart similar in space to the size of the top of this table. And they've got to get a few things on this table. First of all, there's going to be a small device they use to crush the medication. Then we're going to need to get some kind of a container that usually has been transferred to applesauce or pudding. And if they're doing it correctly, they usually have to have some kind of a medium like ice to help keep the temperature stable until they're done. So we'll assume they're doing it correctly. Also, we're going to need is a cup. We're going to need a marker. We need, of course, the spoon, and not the least of which is the medication itself, whether it's one or more pills. Now, many times the pills are kept in a blister pack just below the top of the table in a drawer so that they're safe and are kept away, locked from other people. And what happens when they get ready to start administering medication is they will go ahead and pop out the pills of the blister pack, put them in a cup like this. They'll take the marker, they'll write the patient's name on it. They'll then put it in the drawer along with the other medications in the cups, and they'll wait until it's time to go ahead and pull it out and administer all at one time. So assuming, of course, that these don't get tipped over or have other issues, which we assume these nurses are good, and that won't happen, at the point they're ready to administer, they pull out the proper person's cup. And now they're going to go ahead and take and administer or drop this medication into a mixing or, a crushing device. Then they go ahead and take that medication, they drop it into the cup. And so now they're going to take the spoon and get whatever amount that they think is going to be helpful to mix this up. And they put it in there and they mix up the medication. Again, this helps to make it go down a little more smoothly for the patient. And then they're going to scoop it out and deliver it. And again, sometimes they may have to scrape the cup to get a little more than what they need. But as you'll notice, if you zoom in, no matter what kind of spoon you have, and there's different shapes and sizes, there's almost always going to be both medication and material still left in the cup, making you wonder how much of it actually is going to be getting to the patient. What kind of dose are they really maybe getting? Now we're going to get rid of all this stuff now. We're going to get rid of the spoon and the cup, get rid of the marker, we're going to get rid of the bowl and whatever else it may be holding. And again, we still have the crushing piece on here, but look at this open space. I'm going to have the medication and we're going to have the Medi-Spoon. So as you can see, much more space available because we only need to use it when we're ready to actually administer medication. So what's going to happen is, again, they're going to take the blister pack out when they're ready, and they're going to be able to drop that into the get crushed just like they normally would. And as they do that, and it's crushed, they're going to basically pop this spoon, okay? And you're just going to turn it until you hear a little pop. Then they're going to go ahead and drop in whatever amount of medication they may have. And now we just take and squeeze out as little or as much as we think is necessary for them to take the product. If you'd like, you can stir it up if you want to, but I also find you can take it just like this. Now that's the good stuff because that could be anything. That can be pudding, applesauce, whatever you want, but as you look at it, look, very little of anything in there at all, especially no medication. So clearly, this has been a much simpler way to go ahead and do it. But not only is it more simple, it's better because it ensures real-time application of how much of the pudding somebody may want in the spoon. All you got to do is squeeze it. And then if they have more than one dose, they can do it again. And this is the good stuff, it really is. Now, when you're done with it, you simply just throw it away. It's recyclable. So let's talk about it. No cross-contamination, moving pudding or applesauce or some other type of mixing solution from one place to be held on the table in the open air, mind you, and then be transferred again to a cup, and then to be transferred to a spoon before finally being administered. It's already here. You just go ahead and apply as much as you want or as little as you want, and then you take it, and that's it. Also, you're going to find that they're not only getting less cross-contamination, they're more likely to get more, or if not all, of the dosage that they're looking for in the medicine, and they're getting all this good stuff to help them at the same time. Lastly, because it is a medical supply, it may very well be reimbursable by Medi-Care. So now you see the benefits and the reasons why you need to try your Medi-Spoon. So please, right below, click the button and request your free sample today.